The American Society of Health System Pharmacists is one of our big national associations that we've talked about a lot during this course. And they've had their fingers in a lot of the changes that are happening in contemporary practice, especially for health system practitioners, and certainly where we seem to be headed in the future. We're very fortunate to have with us in this video recording Douglas Scheckelhoff, who is Vice President for Professional Development at ASHP. And Doug, thank you for joining us. We'd like to pick your brain in terms of where we seem to be headed in American health system pharmacy. And as we think about that, as we start, Doug, could you just describe for us what do you think are some of the factors in health system pharmacy that will change where we go in the future?
Well, thanks, Ken. I think there are a number of factors, but a few that come to mind. One factor that will impact the future of pharmacy is that of just general societal needs. And we know that we'll have an aging population, and an aging population uses more medications. That aging population also has unique needs related to medications, and pharmacists can really play an important role in making sure that they take their medications appropriately. Within the health system environment, we know that many of these patients are within the hospital, sometimes as inpatients, sometimes in critical care units. And again, the fact that they're on many medications, that they're living longer, all really lend themselves to the services and the skills of a pharmacist. A second factor that will impact the future are really new drugs and new therapies. And we know that there are a number of new and complex drugs that are being developed and that will be released in the coming years, and they'll have a big impact on improving patient outcomes. On the other side of it, though, these drugs will require a lot of care and handling in terms of identifying the right patient, dosing of the medication, monitoring the effect of the drug. And again, the skill, the training, the experience of the pharmacist will be a great help in improving outcomes with the use of these new but complex medications. Another factor that I think will impact practice is really the training of the pharmacist. And pharmacists are better trained today than they've ever been in history. So when you look at the curriculum of pharmacy schools today, the clinical training that pharmacists receive, and on top of that, many go on to complete residencies in pharmacy practice, like a PGY1, or in specialty practice, a PGY2, we have pharmacists with skills that are tremendous. They're very impressive, and they really allow the pharmacist to take on much greater roles and responsibilities, and that factor in itself will impact what pharmacists do in the future. And then the last factor that I'll mention is just the healthcare workforce in general. So if you not only look at pharmacists, but look at physicians, look at nurses, nurse practitioners, physicians' assistants, and the supply and demand of other providers, I think, will also influence what pharmacists do. So, for example, if they're predicting, and they are predicting, a shortage of physicians, it logically makes sense that pharmacists will be more involved in managing patients to help fill some of that void. So those are just a few of the factors that come to mind when I think about the future and some of the factors that will influence it.
Yeah, that's great. And we've talked about primary care shortages as a particular influencer on what you just said, so that fits right into that scenario too. So Doug, we've talked this week about personalized medicine as a contemporary issue and kind of a future game changer, if you will. And so as we think about personalized medicine and healthcare systems and things like pharmacogenomics, I mean, how do you see that? I mean, it's changing the way we practice right now. How do you see that changing the way we treat patients in the future?
Well, I think breakthroughs in new therapies like those that are genetically based is exciting. I think it'll change the way we treat patients, much as you have said. And I think it'll allow us to customize therapies and really individualize therapies to the greatest benefit of patients. So we'll be able to know really before the patient receives a medication whether it's going to work or not, most likely. I think that the pharmacists, with their training in biology and pharmacology and in science in general, really is very, very well suited to be very involved in monitoring these therapies and helping identify the appropriate patient for these therapies, and again, are very well positioned to be a big part of how these drugs and therapies are used. Right now, we know that pharmacy schools are doing what they can to make sure that students are being taught about these therapies, how they work, and how they should be used. But it will continue to evolve over time. So not only current students, but existing current practitioners will need to do what they can to help develop their skill set and be more involved in how these are used.
It's in our course we talked in the beginning about a fellow by the name of Paracelsus in the 16th century and the identification of the idea that there's a chemical philosophy of how we treat disease and that we're kind of targeting a specific thing with a chemical. And if you think about that, it's just more of that. I mean, we're really kind of refining that chemical philosophy, aren't we, in terms of really targeting therapies more personalized to what this patient needs, I suppose.
Yes, I think it's very exciting in knowing how these drugs work and knowing the genetic makeup of a patient. We'll be able to customize and individualize their therapy far greater than what we've ever been able to in the past.
Yeah, it just keeps evolving. So Doug, there's a thing that we talked about earlier in our course called the Pharmacy Practice Model Initiative. I know that you've been really involved in that project and kind of redefining what the kind of the practice model is for health system pharmacy. How is that going to change the way people watching this video might practice in health systems if that's where they end up?
Well, I think the Pharmacy Practice Model Initiative, or PPMI as we refer to it, has been really an excellent opportunity for health system pharmacy to step back and look at how pharmacists are spending their time, how pharmacy technicians are utilized, and how automation and technology is used within hospitals and health systems more broadly. And what we saw over the years has been that there are some very progressive practice models where pharmacists are very involved in patient care, but there are other settings where it may be a different situation. And the PPMI doesn't really give a recipe or a formula for what the practice model should look like, but it does identify key activities and tasks and roles that pharmacists should be involved in, generally focused around patient care, roles and responsibilities of pharmacy technicians, usually around drug distribution and drug preparation, and how automation and technology should be used safely to improve both safety and efficiency of drug distribution. And we see a lot of exciting models that are out there. Since we had the PPMI Summit back in 2010, we have developed a number of resources that are based on the recommendations that came from that summit. And what we've seen is hundreds and hundreds of hospitals that have either changed their practice model or are planning to do so in the coming years, largely based on the recommendations from this summit. So it's an exciting time. We do see the recommendations help to advance practice and move things forward, and we'll have to see what happens in the future. But I think it's been very effective.
Yeah, thank you, and thanks, Doug, for what you've done to move that along. I know you've been very involved in it. I guess if we think about practice models in the future, another question I have kind of relating to that is pharmacist privileging. So I know that on our campus and on other academic medical centers across the country that pharmacists are being privileged to do certain kinds of patient care roles that maybe my generation or those in the past were not able to do. So what do you see in terms of pharmacist privileging, and how is that changing things in pharmacy practice?
Well, I think the idea of privileging and credentialing of providers is in itself is not a new idea, and it's been used by medical staffs in hospitals and other settings for a long time. The inclusion of other providers, and in this case pharmacists, is very exciting because I think it recognizes in a very formal way that pharmacists have the training and the experience and the expertise to be able to provide different types of direct patient care activities. And so the recognition formally through this mechanism, I think is very positive, and I believe that we'll see it grow beyond hospitals and health systems to other settings in the ambulatory care environment and others as well. So a very, very positive thing for pharmacy.
Yeah, so all this model changing, privileging, provider status that we've talked about in our course really is a sort of a sea change for pharmacy potentially. So Doug, one final question, and I know this is hard and to look this far ahead, but I want to ask if we look 25 years in the future, I'll be long retired by that time, and maybe you too, for that matter. But what do you think pharmacists will be doing in 25 years in the United States? Maybe particularly in health system practice.
Well, I think exactly what pharmacists will be doing is tough to say. Certainly their focus around drug distribution and handling of the product will change, and it'll be much more focused, perhaps totally focused on their involvement with the patient and interacting with the patient. The drugs that we use will be different, and I think that'll shape what pharmacists do 25 years from now. I think the role of the pharmacy technician will continue to evolve. They'll be better trained, and they will be totally responsible for the drug distribution side of the equation. And I think the use of automation and technology, again, will really change how the product is prepared, how products are handled, and further remove the pharmacists from that aspect of practice where they're very involved in it now. I think the other piece related to automation and technology is just the use of data. And we have evidence now through publications and other things that help guide practice. But I think the use of data, how patients respond, and how it can be used to improve outcomes will be remarkable. And again, I think that'll influence how pharmacists practice, and they'll need to be prepared to utilize data, analyze data that is available to them as it relates to medication use.
Yeah. Well, Doug, we really appreciate you being with us. You're a person who's really been at the forefront of a lot of these changes we've talked about today and earlier in the course. So thanks for all you've done to help move our profession along, and we really appreciate you being with us.
Well, thank you for the opportunity. I think it's an exciting time, or will be an exciting time in the future for pharmacists, and just glad to be part of it. Thanks.